talk is titled Equity in the Classroom, Peers, Educators, and Families, and I'm very sorry that I don't have a hockey analogy. Sorry, I didn't plan ahead in that way. But I would like to just start by a bit of positioning and acknowledging the land. I know there was a land acknowledgement at the beginning, which was really beautiful. I also want to acknowledge the land in which my research takes place. I mentioned this briefly in the panel, but I want to spend time talking a little bit about that. So the Early Childhood Collaborative Research Center at Mount Vincent University is in Chibougamau, part of Mi'kmaq, the unceded ancestral territory, which remains the homeland of the Mi'kmaq Nation. This territory is covered by the covenant chain of treaties of peace and friendship signed between 1725 and 1779, and these treaties are affirmed by the Supreme Court of Canada and recognize Aboriginal title. In our research, we recognize that we're all treaty people and have a responsibility to uphold these treaties through relationships of peace and friendship. We acknowledge our territories to pay respect to the knowledge embedded in the Indigenous custodians of the lands and waters and to the elders past, present, and future. So I'd also like to start with telling you a bit more about me. Thank you so much for the kind introduction. And with that, I think I wanted to tell you a bit about the context that helps my work. And also thinking about positionality and research that relates to equity is a really important thing for us to do to reflect privilege and intersectionality. So I'm a cisgender white woman born in Nova Scotia within a French settler family in Prince Edward Island and Nova Scotia. As a settler, my gender, race, and citizenship have afforded me privilege to become a first-generation university graduate and to go on to further graduate studies in snowy Edmonton and obtain my tenured position as a faculty member at Mount St. Vincent University. And identifying this privilege comes with the responsibility to play a part in changing the conditions that influence current inequities for young children. I approach my research with this lens of equity alongside of my personal and privileged experiences with children in my own life. So as a mom of two, I've deeply felt the love that comes from them and also the challenges in navigating disconnected systems. I'm also privileged to work with a hardworking, diverse team, which is at the top, just some of them, some of whom are with me here today that help achieve our collective goals and ensure diversity. With this positionality identified, I'm thankful for the opportunity to share my collaborative work with you that relates to building equity in the classroom. So the Early Childhood Collaborative Research Center is located at Mount St. Vincent University, and it's part of my research chair as a Canada Research Chair to really build a program of research that's focused on early childhood research. The goal of our center is to look at ways to enhance well-being by ensuring that policy and practice supports the needs of families that experience inequity. We do this through three key pillars. One is that we look at existing initiatives happening in the field that support early childhood through early learning and childcare and other systems. So that's through population evaluation. We study what's happening and learn how we need to adjust to better support the needs. We include an aspect of leveraging family and community voice, so we engage in participatory research that really leverages the experiences and voices within community. And then finally, there's a pillar that's focused on making research move beyond doing the research, but having an impact within community. So a large emphasis of our work is on knowledge mobilization and bringing that research to those in positions that can do something about it. So in my time today, I'm going to explore inequity in Nova Scotia and the ways that we can move forward through equitable systems, through some specific examples of our research. So I'm going to spend just a little bit more time talking about the Nova Scotia context, given where we are. I think that is really important when we think about the potential transferability of some of the findings of our work. And I'm going to specifically hone in on three research examples that highlight the voices of newcomer families, our Black and African Nova Scotian families, and the well-being of early childhood educators. So I've already shown this slide, the context of Nova Scotia being in Mi'kmaq and the founding cultures that make us where we are and who we are. And one thing I just want to note at the top is this, I'm sharing this for the reason of really highlighting the socioeconomic, geographical, and racial disparities within early childhood systems, which Lentz and Billings spoke to as reframing from a deficit lens, but about thinking about it being an achievement gap for children, but to frame it on the system itself and thinking about the gaps that properly address the root of disparities in historical, economic, political, and moral systems that impact our systems. One other aspect that I wanted to talk a little bit more about is the poverty statistics in Nova Scotia. So I've cited before 1 in 4 children living in poverty. And a recent report from the Canadian Centre of Policy Alternatives, who do a child poverty report at least every 2 years, noted actually a decrease in child poverty in 2020. But there's a reason for that decrease, and that was the temporary benefits provided by government in terms of income. The temporary benefits provided to families. But what it did show is the potential of government investment in poverty and what that can actually do to income for families. But what we know is that cost of living has gone up, and likely what we're going to see in the next iteration of our child poverty report are higher rates of poverty. And we also see higher poverty among certain geographical areas. That was in the panel. I noted the Cape Breton area is one area of high poverty. And then also among our Indigenous children, immigrant and racialized children. And we're going to spend some time talking about immigrant and racialized children in some examples of research that we've done. So first, looking through the lens of newcomer families, I love sharing this example, as all of the photos you'll see are taken from participants. So I'll tell you a bit of the story of this work. This research was a project funded by the Social Sciences and Humanities Research Council in partnership with our local settlement agency, ISANS, the Immigrant Services Association of Nova Scotia. The project was really inspired by our curiosity, really stemming from the literature and the gap of information of the experiences of newcomer families as they navigate supports for young children. So our team led a scoping review, which is a systematic search of the literature to better understand what we knew about access to programs and services for newcomer children across the country. We learned a lot in that scoping review, and particularly highlighting some of the gaps that newcomers face with respect to the systemic barriers that are exacerbated by their immigration status. So things like under and unemployment being one of those examples. We also identified that the majority of the literature was not based in Atlantic Canada. It was sort of west of us here and west on forward. And so that identified a need for us within Atlantic Canada to really identify more about what some of those unique experiences were for newcomer families that were coming to Nova Scotia. So that led into this SSHRC-funded research project, which used a participatory photo voice process that is shaped by feminist theory, which prioritizes the experiences of those that have been systematically excluded from research. So the photo voice methodology, for those of you that aren't familiar, really attempts to shift policy and ignite community change by destabilizing universality notions and thinking about the unique perspectives of people in communities. Photo voice, it uses photos to voice the experiences of families. And so we did this in partnership with the Immigrant Services Association of Nova Scotia, or ISANS, by really understanding families that were accessing services through their settlement, both within their settlement and then in the broader community. So we engaged a group of ECEs that were working for ISANS and families that were accessing services through ISANS, and went through a participatory process where we met with them, discussed their ideas that relate to access and use of services with the appropriate support for our newcomer families. So we did this in partnership. We actually allowed them to decide how they wanted to participate, if they wanted to do it with a friend or family member, if they wanted to do it by themselves, as a way of really identifying the way that they felt comfortable. And we also, yes? It's not on for them?
I don't know what that was.
Excuse me. Is it muted, maybe?
I'm not sure.
It's muted. I'm really sorry online. Hopefully there was a bit recorded. Can you hear me now? It was muted up top. That's too bad. Okay, so I think I was speaking about the focus of this photo voice project, lost my steam there. So we worked with ECEs and families And the Photo Voice project was really providing that opportunity for them to engage in critical dialogue about programs and services and facilitate knowledge mobilization. So Photo Voice engages participants in the process of knowledge mobilization, so they got to determine how the results would be shared and who the results would be shared with. And I'll share a slide that talks about that a little bit further. But one of the things that I wanted to note in relevance to really engaging newcomer families at the place that they were is that we, of course, provided interpretation services as was needed and translated materials to provide them an opportunity to really engage in the way, so taking down some of those barriers that might prevent participation in research. So these are some of our photos, and I have QR codes throughout the presentation so you can take a look at our full report. So these are some of the photos that participants took that told us about what it meant for newcomer families to find and use programs for young children. So some examples that I'll just highlight here. The story of the sunflower was one where growth happens when and nurtured by access to programs and services. That was sort of that analogy that an educator provided for that, the beauty that can come from access and the potential that can grow from that. Others reflected on the place of residence being playing a part, similar to my remarks around geography. Access means getting there, it means transportation, all of those things that can be difficult as you navigate a new place. Aspects around challenges during the pandemic were also noted. So we did this research in 2021, just after the pandemic. So a lot of families were still reflecting on that time and the barriers that they faced. So that that's open, just slightly open door was one person's way of saying this was our glimpse into the classroom. These are our children that we had to let go, and we're not comfortable yet in doing that, right? So that was that picture there. And on the top of that, our capable and confident children was reflecting upon, really the potential of children when they have the supports and that feeling of letting go. That's how one of the participants described that as her daughter across the street. And also our participants talked about the importance of play as a foundation for early learning and childcare and supporting children's settlement. So play as a support for settlement and the child settlement journey. So these themes were actually this is another part of Photo Voice where participants are engaged in the thematic analysis process. So it wasn't the researchers kind of getting some information from participants and going away and creating that. We actually did that with them through the process of our workshops. So our participants discussed, so the one on the left is the ACE thematic description, and the one on the right is the one from families. So some common things were discussed in that. Participants discussed the systemic barriers that obstructed newcomers' families' access to services for young children, financial challenges due to underemployment or unemployment, language and cultural differences were emphasized. Despite these barriers, participants also shared how culturally responsive programs enhanced their connection to some programs and services, especially offered through the settlement agency. Both groups of participants also discussed the critical role of social networks and how they play such an important part of the settlement journey. So this project, as I mentioned, participants were engaged in the knowledge mobilization activities, and what they wanted to do was to share the results at a public outdoor exhibit. So this is at a public outdoor space in Halifax called the Amera Oval, and we had the opportunity to show the work of participants. There was a lot of interest from media, and we also had the opportunity to move the exhibit around to some different public places like museums and libraries. And importantly, there were the findings of this work, but it actually led to a new project with our settlement agency that was really trying to better understand the settlement agency childcare and the differences between the regulated childcare system. So that led into a pan-Canadian scan of early learning and childcare for newcomer children. And this was funded by the Child and Youth Refugee Research Coalition, which is a partnership grant through SSHRC. And we had the opportunity to speak to settlement agencies across the country to learn more about how childcare is delivered with settlement agencies. So we did this because our iSANS partner was interested in learning from other jurisdictions and knowing how they might be able to innovate their program to better meet the needs of newcomer families.
We also heard the differences of childcare that's operating directly within settlement to a childcare in the community, and how different that was and how different those systems were, even with respect to funding. So this was our research. We did an environmental scan, which included an iterative process of looking at websites, a survey, and interviews to have conversations about the meaning of what we were seeing and learning. And you can see the slide there in terms of who we had that participated. And just some key findings, and I have a QR code again for the full report. Just a few in relation to this work that I thought would be relevant. Some of the strengths and challenges that were identified within settlement agencies in the delivery of childcare was that first, that wraparound support that settlement agencies provide to their families. So it's not just childcare they're providing, it's the other supports that families need for settlement. And that was actually different when they were accessing community childcare sometimes. They didn't have that same access to supports once they weren't able to access childcare within the settlement agency. Another aspect was the diversity of program staff. A lot of the staff working within the settlement agency for childcare had newcomer experiences themselves, so they could understand the settlement journey, and they could support families with that through that connection to that experience. And then moving on to the challenges, the unique and complex needs of newcomer families was noted as just something that it's real. Every newcomer experience is different, and that sometimes with limited resources, that was challenging for some of the staff. And then one of the other aspects especially relevant to our conversations today is that many of these childcare programs were not provincially licensed. In fact, it operated quite separately from our regulated system. And that meant that they couldn't avail of supports through the Canada-wide early learning and childcare agreements. And at times what that meant is things like as compensation frameworks were being rolled out, it actually almost created a two-tiered system where they were looking at wages through the regulated system, but there wasn't that same kind of funding available to ensure that they could keep the diverse, knowledgeable staff within childcare. So that was a concern that was noted from them. So I could talk more about this area, and certainly in questions I'm happy to elaborate. But due to time, I'm going to flip to the next project. So another aspect that I'm looking forward to sharing a bit more about is a collaborative project that I've been working on with colleagues from the On These Shoulders Research Collaborative, which is led by Dr. Barb Hamilton-Hinch at Dalhousie University, and Crystal Watson, who is a PhD student at Dalhousie in health. And we have been working on this project for a few years now, started pre-pandemic, and just this past summer we had the opportunity to do this community event that I'll speak about. And this is really exploring and amplifying the voices of Black families and educators. So before I launch into what we did, I just want to provide a bit of information about the history of Black heritage in Nova Scotia. So we have a rich history of Black heritage that dates back over three or more generations for many African Nova Scotian people. And you can see there that 3/4 of our African Nova Scotian people have been in Nova Scotia for 3 or more generations, and we have roots in 52 African Nova Scotian communities. And African Nova Scotians represent 44% of the racially visible population. And as I mentioned before, this education debt, there's been a lot of attention from the Department of Education and Early Childhood, achievement gaps. They're still sometimes calling it achievement gaps with respect to racialized children in our education system. But as a result of that, they've introduced some funding for researchers to engage in research to better understand that gap. So our team was able to avail of that funding. It's through the Inter-University Research Network, which is through the Department of Education and Early Childhood Development, our provincial government. And we were able to design this study as a way to better understand this area. And certainly as greater attention was in this area of equity in early learning and childcare, we really wanted to provide an opportunity to leverage those voices and better understand the current situation and what we might need to do to better support Black children. So what we did was a qualitative research study where we interviewed, again, early childhood educators and families, and we had 3 areas of focus for our work. We were curious about how Black children in Nova Scotia access play, including risky and outdoor play. We wanted to learn more about how racism and discrimination are experienced by Black children in Nova Scotia in their early childhood period. And then how families and ECEs view early learning and childcare environments for Black children. So in this, we used critical race theory, which has been developed by Black and African American scholars in the mid-1970s. And then alongside of that, we identified Black crit theory as an opportunity to really dig into aspects with respect to anti-Black racism. And there are 5 tenets that we use to really explore and dig deep into the roots of some of what we heard during the interviews. So I'm going to share just results around those 3 themes and talk a bit more about some of the voices of our participants. So Black and African Nova Scotian families and ECEs really talked about the value of outdoor play. They spoke fondly about their own experiences in outdoor play as young children. Participants described personal experiences, personal experiences growing up in Black communities where unsupervised free play was encouraged and normalized. But then also families spoke about their current fears of being over-policed, over-surveilled, and stereotyped. Participants across communities spoke about the fear families had when Black and African Nova Scotian children engage in risky play due to the consequences associated with potential injuries. Further, participants shared the history of over-surveillance on Black parents across different systems. We also heard about underfunding within communities and the lack of infrastructure within our African Nova Scotian communities to engage safely in outdoor play. And that was with respect to infrastructure like play areas, early learning and childcare opportunities, and also aspects around road safety like sidewalks and effective public transportation. Another area that we explored was specifically around Black families and EC's experience within early childhood settings. And our 3 themes are identified there, and this is a paper that we're pretty close to publication at this point, so certainly stay tuned to our website if you're curious and learning a little bit more. We learned about the pervasiveness of the curriculum that really dominates a white norm in these settings, such as through curriculum and the programming that happens. And our ECEs also talked about the challenges they've encountered when infusing an Afrocentric approach into the programs, often receiving pushback from colleagues or program directors and supervisors. There is right now an Afrocentric cohort that's being implemented through our Nova Scotia Community College, but even with that, they were in that safe environment and learning through this Afrocentric model. But what it meant when they were going into the community trying to do that was not that same acceptance and appreciation of that approach. ECs and parents also talked about incidents of racism amongst children, young children, and white ECEs, indicating feelings of unpreparedness in addressing such issues. Our participants talked about their lack of knowing what to do when they saw something happen, and really that gap in knowledge of how to address racism within early years systems. The final aspect is precluding Black children from culturally safe environments, and this is something that we've been talking a little bit more about with respect to cultural safety. So parents and ECs reflected on the diversity in early learning and childcare settings, and also linking the importance of representation to children's sense of belonging. Parents discussed stigmas and stereotypes that they've encountered in childcare setting. And parents also talked about their concern of how they were being treated differently. And then lastly, we've looked at racism and the impact on Black families in general. The intergenerational impacts of racism were clear. Parents and educators expressed fears and concerns about their children due to the racism and discrimination they face themselves, creating this cycle of fear. Participants knew their children would eventually encounter it, and they felt this sense of really wanting to support their child in ways to really promote their cultural identity and pride. So this research, it's the first of its kind, at least in Atlantic Canada, to really highlight some of the real issues that still exist within anti-Black racism in Nova Scotia. One of the things in doing this work, we wanted, again, to hear these experiences, provide an opportunity to families and educators to share their story, but again, bring that back to community and government as an opportunity to figure out what we can actually do about it. So we held an event in East Preston community in Nova Scotia, which is a historic African Nova Scotian community, to talk with community about issues happening, what's currently happening, and also moving to what needs to happen to address some of the issues with respect to anti-Black racism across the province. So again, our QR codes are there if you want to learn more. We do have some papers coming out that further dig into these issues. And spinning from this sort of community event in July did come a lot of government consultation with respect to, again, bringing the voices of community to decision making and supporting actions that relate to professional development and other ways, in addition to professional development, to really address some of the systemic issues with respect to access to childcare and a culturally responsive program that welcomes Black families and children. So the very final research example that I'll share is one that relates to equity and well-being among early childhood educators. We know, and we've talked a little bit about this, the professional identity of early childhood educators, placing that value on ECEs in the profession is so important. The Canadian Centre of Policy Alternatives, again, they wrote a report about ECEs feeling underappreciated and underpaid in 2020. And since then, there's been a lot of actions, as we all know and have been speaking about through the Canada-wide Early Learning and Childcare Agreements, that have emphasized ways to support professional recognition, pathways to learning, and lifelong learning. And our team, in collaboration with the Department of Education and Early Childhood Development and the Nova Scotia Early Childhood Development Intervention Services, we're curious about how some of these changes were impacting the state of well-being among our early childhood educators and among more broadly early childhood professionals. So this research is preliminary at this point. We're still digging into the results, but I felt like it was a relevant one to share today. We did a survey that used an existing professional well-being scale for early childhood called the Early Childhood Professional Well-Being Questionnaire, or the ECPDW. It's a recently developed survey which looks at senses of well-being, including those that relate to security, affinity, self-respect, engagement, agency, and efficacy. So these senses of well-being contribute to the overall score of early childhood well-being overall. So we implemented this survey along the same time actually that the compensation framework was being implemented. So it was actually a really interesting time to do the work and to learn more about how the educators were feeling about their professional well-being. The survey covers a range of topics according to those senses. In the end, we ended up with almost 429 total responses from early childhood professionals. This is a very descriptive look at the results, more to come, but we did have most that responded in an early childhood education role, and we had sort of a split of individuals who were 0 to 10 years and those that were working in the field for longer. So that kind of gets at different aspects of well-being based on amount of time in the field. The histogram graph on the slide there represents individual profiles of well-being in terms of their overall score. So that's adding up the responses to their questions and where they placed on this overall score of well-being. The higher the score, the higher the professional well-being of the individual, and the highest score there at the tail end of the right is 135. So we found the average score is 107, which is actually a bit higher than some of the other professional well-being research that's been done. But what's important is that we don't just look at the average, that we actually also look at the tail and try to better understand those individuals that don't have a good score of professional well-being and understand why that is and what's contributing to their professional well-being. So more of that story to come. We're in the process of doing that analysis right now. But just to give you a bit more meat in terms of what this survey was all about, I'm providing a few samples of the scale item results here. So there's 4 items on the scale that I just put there for context about what this survey is all about. So the first 2, back and forth communication with other adults in my work setting are difficult, and I feel others question the decisions I make in the setting. What we're looking for here is the lower green and blue and the higher red and pink. Opposite, sorry. As I said that, I was like, that's opposite. Yeah, so we're looking for back and forth communication. We want someone to say that that rarely happens. So we want to see more red there. But what we are seeing is, in terms of the sometimes and rarely items, that there actually is quite a bit that are still reporting on that scale. So they're not at the fullest extent what we want to be seeing for those items. And the other two is, as I thought was for the first two, I feel free to practice according to my professional beliefs, and the emotional climate in my work setting puts me at ease. In that case, again, we're looking for, in this case, we're looking for that positive. So we want them to say almost always in that. And this one's actually pretty good, but we're still seeing some that are reporting rarely and almost never. So there's just some quotes up there on the screen about some of the issues. And again, we have a public report that you can look at that further digs into some of the items and some of the background literature in this area. So something to look into when we're thinking about the equity and equitable early childhood system, and thinking about the early childhood educators that are working within the system. So just to wrap up, I'm sure my time is coming to an end here. Some key recommendations from our research in addressing inequity. One of the aspects across our projects that we've seen is the potential of really thinking about the partnerships that can enable within and outside early learning system to create access to early learning and childcare, and more holistic systems that provide support for a family in many ways. So this is like the example that I shared about, building on the infrastructure that schools offer, and it's also things like understanding where the partnerships can be within settlement agencies to regulated childcare system to really support that capacity and to support newcomer families. Another aspect of recommendation is around the importance of supporting well-being. We've been talking about that to get educators to stay in the field through things like fair compensation, enhancing professional identity, and also encouraging cultural and social emotional safety. So the well-being survey is about social emotional well-being for educators, and we need to pay attention to that as that will really help to enhance them, again, to stay in the field for us, for everyone. And then the final aspect is around the importance and the potential of participatory or community-engaged research and how that can mobilize voices of families, communities, educators to identify solutions. And the very final slide I have here is repeating some of what I've said, but the importance to keep thinking about socioeconomic, geographical, and racial disparities within the early childhood systems, to keep thinking about anti-oppression within programs, to really find ways to build inclusive and culturally responsive programs, and always seeking opportunity to leverage voices from those that experience inequity in the stories from families and early childhood educators, and I would also add from children. And I think that voice we need to kind of keep bringing forward with respect to the right of education for our children. And that's it for me. Thank you.